Now it causes shearing stress, intracellular, extracellular responses leading to nitric oxide synthetase and vascular endothelial growth factors. These all actually cause neovascularization leading to the better erectile function. We have successfully used since 2005 and we have started using in 2017. We got good results in 2014. We purchased a machine in 2018 and the machine is portable. We can use in any room and it is a very patient-friendly machine where it's a semi-ellipsoid having saline with some electrolyte solution, and we have done it in 422 patients. Each treatment actually lasted for 15 minutes. We use actually 5 places. You can see here the 5 places. We start with thrust, left thrust and right thrust, and the 3 parts in the penile shaft. Now if you see, this is the video. These are the blood vessels. We are actually targeting the cavernous arteries. They have got microcalcification. The stiffness of the arteries, actually the fragmentation of the calcification causes neovascularization as well as the expansibility and elasticity is restored. That's how the principle of shockwave therapy. You can see the diameter of the cavernous artery doubles at the end of treatment. The treatment schedule is about 12 sittings and these 12 sittings are completed in weekly twice, so totally 9 weeks the treatment is complete. Most patients, they actually tolerated this easily because the shockwave is very mild. It only gives little sound but nothing more than that. No pain, no hematoma, no swelling, and hence the patient compliance also very high. Now if you see here, week 1 2 times, week 2 another 2 times, and week 3 another 2 times. We give a rest of about 3 weeks in between and call them again for the next 6 sittings. Total 18,000 shocks are given, and in this 422 our results showed that about 78% of them had good results at the end of 3 months. The criteria were International Index of Erectile Dysfunction, ED domain score, and then if you see how the follow-up was, and EHS, erection rigidity score. These two were the criteria for us to actually find the improvement. And most of these patients, IIEF increased from, they were actually around 10 to 13, which is a severe erectile dysfunction, but the increase of 18 to 23, about 78% of them, which shows there is a good response. And EHS, actually EHS shows that it is larger but not hard. This is the first where we started here, but here it's hard but not hard enough for penetration. The third one is hard and enough for penetration, and completely hard. Stage 4 was not achieved, but grade 3, we can say it's hard and enough for penetration. Most of the patients are diabetic or elderly and they have a lot of period of erectile dysfunction, so we can't expect wonders, but the penetration is enough for them to have satisfaction. Now if you see how we have monitored is ultrasound Doppler. We have seen the cavernous artery, whether there are any blocks here. See, the continuity of the vessel is not there, and at the end of the treatment we found that the venous blood flow is increased, peak velocity is better, the diameter is better, the blocks were narrowings were reduced. And if you see the scores, 78 out of 422, 329 patients actually improved in the II score, which is significant by p-value. And then at the end of all this, most of the patients actually, they come out for 1 year or 2 years only for the follow-up. Majority of our patients did not ask for another repeat treatment even after about 6 to 8 years. That's our follow-up. And if you see here, the study emphasizes the feasibility and tolerability of extracorporeal shockwave therapy in vasculogenic ED. You are very careful to screen out the vasculogenic ED only, not the neurogenic or psychogenic. No reported side effects, and the treatment was well tolerated. Study shows significant improvement even after 6 months, and it can be used to treat even in the Peyronie's disease. The number is not so much, so we are not presenting that Peyronie's disease, but it emphasizes the physiological effect of shock waves on the venal hemodynamic apparatus. So further studies are necessary to evaluate the methodology for Peyronie's disease, which also is being done widely all over the world. Thank you. Yes, sir. Yes, sir. Yes.
So what is the result of the severe ED?
Most of the patients are severe ED only. They have already used all sorts of drugs, PDE5 inhibitors. At the highest dose, they have gone more than 100, 200 milligrams without their knowledge, and then they have cavernous fibrosis. And they were suggested penile implant also somewhere. As a conservative approach or non-invasive approach, this method was suggested to them before going to a penile implant. Somebody is not willing for a surgery, somebody is scared, somebody is having sugar diabetes, somebody is obese. We are also not willing for an implant straight away. So this approach actually gives them an option to find out whether it helps. The people, 78% did not go for penile implant. Others we have done implant also. That means these patients actually when they don't get improvement, they are more convinced for a penile implant. So if 80% result is a good result. All over the world it's a very good result because conservative approach, non-invasive, non-surgical, and then it's a physiological treatment. It's not a abnormal or pathological
So
treatment.
you how many sessions? 8 to 10, sir.
No, total sittings are 12, sir. First, initially 6 sittings. We wait for 3 weeks. If the patient is happy, we don't ask them to come for next sittings. Because some majority of patients after 6 sittings, they say they are better. They can manage like that. Only people who want little more improvement or they could not achieve the amount of satisfaction that they want, they come for the another sitting. But the total treatment is 12 sittings in a gap of total 9 weeks, sir.
Yeah, other adjunctive methods we use, like tablets,
Generally, sir, these patients are already used feeling effect, maximum dosage of these drugs. After the treatment, we have used PD5, like sildenafil, 1 month later, and found the patients who are little improved, they are saying that this tablet didn't work for this before, it's working better. So at the end of 6 months, we found that they were able to use the tablets with much better effect if they are not happy with the treatment alone.
You don't prefer for mild AD, sir.
Sorry?
This one, you don't prefer for mild AD. You prefer PDFA or this one?
Mild reading, most of the tablets are enough, sir. Nowadays, we don't have to prescribe. They are prescribing themselves. They are taking from pharmacy. Mild EDs, they have used the tablets for 3-4 years. They have used like that, and the effect is lost either because of tolerance or cerebral fibrosis or severe side effect. Only then they came back to us who are asking why the side effect has occurred. Till that time, they are not come here and enroll at all. And once they know the tablets have lost their effect, then they are asking for this or plant whatever they suit for them.
Does it prevent mild AD going for a severe AD?
With this
early,
technique?
with this.
No, sir. Mild ED, first of all, we don't do. Patient may not agree. And the treatment actually improves the vascularization. It never worsens it. It never worsens. It doesn't cause fibrosis. It actually reverses the fibrosis. Before there are calcification also, they are broken. And hence, definitely there is a positive effect. It doesn't cause any fibrosis or any negative effect on a patient who has got mild ED. It doesn't go into severe ED.
Any side effects?
No, sir, we are not seeing. Initially, patient used to be very wary of the shock. Shock means the term itself is frightening. But when you see it is a vibration, so slowly they understand. Initially, they are giving a jerk. Later on, they understand. But most of them, there is no confusion. There is no blackening or reddening of the skin. There is no hematoma. There is no swelling. So every alternate day they are coming to us means there is no side effect. Otherwise, they won't come. If there is pain or anything, they will not come. Contraindications are urogenic impotence. You cannot touch them because they will not have any result. And psychogenic also. You cannot justify. Because it costs something. It costs them 5,000 to 8,000 per city. So for a person without objective evidence, we cannot convince them. Only Doppler study, maximum flow, velocity, all these things actually convince them to go for the treatment. And at the end of that, we are doing that and seeing that this much improvement has occurred because of the machine. They are also happy. And the longest survival, around 9 to 12 years, the beneficial effect stays. So they need not come for next 6 to 7 years. That also convinces them.